Good evening. Thanks for joining us. As CTV News first reported, the health minister has now confirmed that 6 children have died from influenza so far this year. It's a shockingly high number, particularly so early in the season. So why wasn't government upfront with the public? Penny Daflos is here. Penny, the only reason we learned about these deaths was following a meeting between doctors yesterday.
Yeah, Mijang, really, the leaked information forced the minister's hand here. Adrian Dix did not explain why they did not warn the public that they were already seeing such a huge number of child flu deaths. Usually there are only 5 or 6 deaths Canada-wide over an entire fall and winter.
Behind these walls, healthcare workers are working overtime and round the clock to keep sick kids alive. After doctors from BC Children's Hospital met on Monday, CTV News learned 6 children have died from influenza in recent weeks.
It shows the risks of the flu.
The health minister acknowledged the information is accurate and 2 routines, but didn't explain why he did not tell the public until pressed by reporters.
All of these cases are reviewed both for the impact of the flu, so we understand the impact of influenza on children.
On Monday, the provincial health officer and head of BC's immunization program tried to convince parents to vaccinate their kids.
I cannot stress enough the importance of influenza immunization right now.
But also did not reveal the virus had already proven deadly for 6 youngsters. The BC CDC says some of the children got secondary bacterial infections after the influenza, which can contribute to severe illness.
It allows for bacteria that are perhaps already colonizing the child's airway to enter and invade and cause more severe disease.
Of the sick kids who are tested at BC Children's Hospital, this year the vast majority have influenza, which has been soaring. Some doctors theorize kids are sicker than ever because of COVID.
In British Columbia, 90% of all kids are thought to have had COVID. And we know through laboratory testing that COVID in and of itself can cause immune suppression and immune dysfunction.
Without any public health measures in place, viruses are spreading virtually unchecked, taking a further toll on our hospitals and beleaguered healthcare workers.
It's the entire family that you're taking care of, not just that child, but you're also dealing with the parents' emotional needs. They're scared.
These have been the most difficult conditions the healthcare system has ever faced.
So, Penny, do we know if more seniors are also dying from influenza this year?
You know, Mijang, that's one of the answers that I've been trying to get. I don't have that information. And it's important because experts say it often starts with kids and then seniors follow. It's really unfortunate our health officials have decided to be so secretive about what should be routine public health disclosure. Last week's review into BC's handling of the pandemic confirmed what many had warned about, that hiding or withholding information leads to public erosion of trust in our government, Mijang.